Welcome to Walk with the Doc. I'm Dr. Glenn Barnes with UT Tyler School of Nursing. I'm an associate professor at the School of Nursing, and I'd like to talk to you about healthcare in non-traditional environments. We usually think of traditional places of healing such as hospitals or clinics, but what about those non-traditional environments, such as if you're part of a global health outreach, or during a disaster, or if you're just outdoors in the wilderness? Sometimes we need to provide healthcare outside of a modern hospital or clinic. Today we'll go over the right way to address immediate medical needs in a non-traditional environment. Now, a lot's going to happen in the next couple seconds. So let's just stop time. And let's talk about all the things that'll happen very quickly. First and foremost is scene safety. Your safety. Whatever happened to this person may happen to you. You need to look around and make sure you're not the next casualty. So while I'm ensuring the scene is safe, I'm actually performing the initial part of my survey, which we will use the acronym MARCH to guide us. M is for massive hemorrhage. I see that there is a large amount of blood coming from his lower leg, and it's pooling along the ground. Now, really, that's all I need to know for right now, because I have to address the hemorrhage first before anything else. But airway and R respirations are initially considered intact because I heard the casualty call out for help. I heard the casualty call out for help.
Help.
So we assume that A, airway, and R, respiration, are intact. And I will turn off the chainsaw, move it off to the side, and make sure that there are no overhead limbs that could fall down and then injure me. While I'm moving up to him, I'm going to be placing on my gloves. I'm also going to be telling him who I am, what my level of expertise is, get his name, and tell him that I will help him, and ask if that's okay. So now I have permission to treat him as I'm moving forward to him. I'm also getting information from him about his mental status. So all of this will happen in the first second or two. So let's restart time and see how it goes. Hey, my name's Dr. Barnes. I'm a nurse. I'm gonna help you. First, let me get this chainsaw out of the way. Okay, what's your name? Eric. Okay, now, since his wound is on at a lower extremity, my first course of action is to apply a tourniquet. I keep a tourniquet as part of my IFAK, or IFAK, Individual First Aid Kit. And the tourniquet is applied 2 to 4 inches above the wound, not over a joint, or 2 to 3 inches above the joint if the wound is close to or on the joint. Eric, this is going to get painful, okay? And I'm sorry about it, but I have to stop the bleeding. You keep turning the windlass until the bleeding stops. Reassure your patient that the pain is expected, but you have to stop the bleeding. We next look at any large wounds that if a tourniquet can't be applied because you either don't have one or it's not in an area that you can use a tourniquet, you can pack the wound with any kind of gauze or soft cloth, such as a t-shirt, and then apply direct pressure. Now what I'm going to be doing is I'm going to be packing the wound on your leg with some stuff called combat gauze. It's just a gauze, but it does have some medicine in it that's going to help you to stop bleeding. Now, I'm going to be pushing in here. This is going to hurt, but I've got to get this gauze all the way into the wound, however deep the wound is. Okay, now that the wound is fully packed, I'm going to put direct pressure on there, and as I can, I'm going to take a cloth and I'm going to wrap it around there to hold this dressing in place. I'm going to place the knot directly over the wound so that it helps to apply a little more pressure. Now M for massive hemorrhage is complete. I can go back to A and R, and if the patient is still talking to me, then those are still okay. If not, then I would start my CPR procedures. Next is C for circulation. At this point, I just feel a quick feel for pulses in his wrist. I'm not really concerned on the exact number, just does he have one? Is it strong or weak? Is it fast, normal, slow? Really fast or really slow can mean trouble. H is for several things, hypo or hyperthermia, and when a person gets hurt really bad, we lose the ability to control our body temperature. So to keep them warm or cool depending on the need, and most traumatic injuries need to be kept warm. With my bag, I also carry a poncho and I'll wrap him up with a poncho. H also covers head injuries, and I will talk to him, and as long as he's responding appropriately, I know that head injuries are okay. Now I'm going to use my backpack to help support your head so that you breathe a little easier. Let me turn it the other way. There we go. And I personally use H for help. At this time, you've done as much as you can for the initial life-saving interventions. You need to get help. If you have a cell phone and coverage or a bystander, call 911. If you have to leave the area, make sure you know exactly where you've left him, where you're going to get cell phone service to call 911, and a location to meet the EMS, and then go back to your patient and provide what other secondary steps that you need to for him. Okay, I do not have cell phone service here, but I know I can get it at the top of the hill. All right, I'm gonna run up there, I'm gonna call 911, and I will be back here to you. Okay, I should be gone no longer than 10 minutes. For all this to happen, you need a good first aid kit and knowledge. For more information on Stop the Bleed training, contact Dr. Catherine Corville in nursing, or go to stopthebleed.org. UT Tyler will also be offering healthcare non-traditional environments elective starting in the spring of 2022. It'll be open to any UT students in all the campuses and will be taught by yours truly. So thank you so very much for having this walk with the doc with me. I hope you learned something. And remember, have fun, learn lots, take care of yourself and each other.